Welcome back to CLE Weekend. November, it is Lung Cancer Awareness Month. Now, here's something that you probably don't know. According to the American Lung Association, lung cancer is the leading cause of cancer deaths here in the U.S. But when you say cancer, you know, it's not always the first one that people think of. So what do? Well, we need to bring awareness to this and talk about this deadly disease and the importance of early detection. I do want to welcome Dr. Sharhabeel Jwayyed, Medical Director for Buckeye Health Plan. So first of all, I want to say thank you for coming on.
Thank you for having me.
It is so important to bring awareness, right, to anything that is going to affect our health. But why does Buckeye believe that it is so important to bring awareness about lung cancer?
Well, as one of Ohio's largest Medicaid provider organizations, we constantly strive to improve the health of our members and all of Ohioans. And as you mentioned, I don't think there's enough awareness about the impact that lung cancer has, the prevalence of lung cancer, and how there are newer, easier screening tools that can be used to detect lung cancer at a very early stage, which helps improve treatment and mortality and quality of life.
So how is lung cancer detected?
Well, typically, if you meet the criteria for detection, and that generally involves that you were a smoker with what they call a 20-pack year history of smoking.
Okay.
If you're between the ages of like 50 to 80, what we would recommend that you have is an annual low-dose CT scan of your chest that is designed to detect lung cancer. And the CT scan is non-invasive. That means it's painless, okay, and it's very quick and easy to do. And we recommend you have that annually.
Now, how can we, let's say, lower the risk of lung cancer? I'm sure most people think don't smoke, but in addition to that, what are some options?
Well, you're right. The leading cause that contributes to lung cancer is tobacco use and smoking. So we would obviously recommend that you don't start smoking. If you do smoke, we would recommend that you talk to your physicians about stopping cigarette smoking. Okay. And then we would recommend that you have the annual screening.
Now, for someone who doesn't smoke, myself, so maybe I wouldn't technically be considered high risk. Is there, any ways or things then that I could do to make sure my lungs stay healthy?
Yes. So in general, we would recommend that you follow an active, healthy lifestyle. Okay. We would recommend that that it would include a healthy diet so you maintain your weight. Mm-hmm. By maintaining an active lifestyle, you generally improve the tone and strength of the muscles that help the lungs function appropriately. And by maintaining a healthy weight, you take a lot of stress off of the lungs when they do their normal function.
Now, how is Buckeye helping folks reduce, the risk of getting lung cancer?
Well, we provide help and therapy related to lung or smoking cessation. We provide access to medications and smoking aids. We provide counseling services. We provide the ability to help you members make appointments and members with transportation if they need it.
At one point there was this big surge, right, in restaurants who said, we're not going to let anyone smoke anymore. And you actually saw a lot of people then who maybe stopped smoking or it decreased. Right. And it went down. But people now are vaping. And talk about vaping because they think, oh, it's so much better than smoking. What do you have to say?
No, from a medical perspective, we would also recommend that you don't vape. Okay. We also think there's some potential risk to vaping. There may be some carcinogens in the smoke that you inhale. So we would recommend that you don't smoke tobacco or vape.
Now, in terms of ages, right, like you said, hey, we don't want you to start smoking, but for someone who has smoked, let's say for 20 years, and then they've switched to vaping, still, you guys at Buckeye have a lot of resources, not just for smoking, but people who are vaping, to decrease that and eventually stop.
Right. We have programs where we basically come alongside of our members and help them get the resources that they need to help them stop smoking. And that again includes sometimes medications, sometimes smoking aids like nicotine and nicotine gum and patches. And we have care managers and care guides that can help our members manage the whole healthcare system.
Now, as someone who's never smoked in my life, are there any signs or things I would look for that I would then get that CT scan to say, maybe I should check? Or is there anything that I would feel that would maybe be a sign that I should get checked out?
That's a very good question. but the point of the screening is to detect the cancer early before it causes symptoms. So
Great.
don't feel like you're not eligible for the screening because you have no symptoms. We want to do the screening before symptoms develop. So if you basically have a long history of smoking, and if you're between the ages of 50 to 80, the lung cancer screening with the easy CT, the low dose CT, is the way to go. If you have any questions, you should feel free to discuss whether you're eligible for the lung cancer screening with your healthcare provider.
Okay, that's really good information. For anyone who does want to ask more questions, though, where can they go?
They can go to the Buckeye website. There's plenty of information on our website. There's also information on the website of the American Lung Association.
Wonderful. Dr. Sharhabeel Jwayyed, thank you so much for coming on.
Thank you for having me.
Thank you for all the knowledge and, of course, the good tips. And we want to encourage people, right, to
Yes,
stop smoking. No vaping.
No vaping. Get the scan early before you have symptoms. If you have any questions, talk to your providers.
Wonderful. I love that. Thank you so much. And hey, thanks for being here. We'll be back on CLE Weekend. Stay with us.